Could your daily bath be detrimental to your health after the age of 70? Have you ever considered that the daily bathing routine you have depended on throughout your life might be causing more harm than benefit as you age? We have long been led to believe that increased bathing equates to improved hygiene. However, what if I informed you that upon reaching 70, that hot shower or prolonged soak in the tub could be insidiously depleting your skin, exhausting your energy, or even increasing your susceptibility to perilous falls? This assertion may seem startling, but it is indeed accurate. We have been conditioned to perceive cleanliness as synonymous with frequent bathing. However, this notion evolves with age. In this video, we will disclose some unexpected insights regarding the bathing frequency recommended for seniors, which may contradict your previous beliefs. As we age, our skin undergoes considerable changes, becoming thinner, drier, and more delicate. Consequently, each hot shower, bar of soap, and even prolonged soaking in a tub may inflict more harm than one might anticipate. This issue extends beyond mere comfort. It encompasses broader implications. There are genuine concealed health risks. However, we are not merely highlighting issues, as we possess solutions. Remain with us until the conclusion, as we will reveal 7 astonishing facts that could fundamentally alter your approach to personal care after the age of 70. Additionally, we will disclose one expert-endorsed technique that ensures seniors remain fresh, healthy, and safe without entering a hazardous bathroom. You will be astonished by its simplicity, and neglecting it could result in a less comfortable and secure life. Therefore, if you are prepared to reevaluate the manner in which you attend to your well-being as you age is crucial, you will not want to overlook what follows. Before we proceed, I would greatly appreciate it if you could like this video, as it enables me to continue providing valuable insights. If you have not yet subscribed, I highly recommend doing so and activating the notification bell to ensure you never miss another significant video. Should you find the content appealing, feel free to leave a comment with a 1. Conversely, if you believe there is room for enhancement, please leave a 0. I aim to ensure these videos are as beneficial as possible. Now, let us commence this enlightening discussion. Subject: the concealed risks of daily bathing after age 70, a health hazard for seniors. The routine of daily bathing, particularly with hot water, abrasive soaps, or prolonged soaks, may be detrimental rather than beneficial. This seemingly innocuous practice could be insidiously depleting your skin's protective layers, rendering it susceptible and defenseless. Unbeknownst to you, each shower or bath exacts a toll on your skin. As we age, our skin thins and produces fewer oils for protection. The natural oils, or sebum, that once safeguarded it are diminished. Your skin's softness and health gradually diminish, initiating various problems. Dermatologists elucidate that each instance of cleansing with hot water or harsh soaps depletes essential oils that are vital for preserving the skin's barrier. The repercussions extend beyond mere transient discomfort. Over time, the removal of natural oils triggers a cascade of reactions that may result in substantial health complications. Dryness typically manifests as the initial indicator, characterized by a tight or prickly sensation. Rapidly progress to chronic pruritus, potentially disrupting sleep and causing daytime discomfort. Furthermore, as the skin's defenses diminish, a condition known as xerosis may develop, derived from Greek, signifying dryness. This condition manifests as skin that becomes coarse, scaly, and occasionally fissured. These fissures are significant and can bleed, increasing susceptibility to infections, particularly in the elderly, especially those with pre-existing conditions such as diabetes or compromised immune systems, for whom these skin lacerations pose considerable risks. It is excruciatingly distressing. They pose significant hazards. Consider the exasperation of incessant pruritus or the discomfort of desquamated skin snagging on garments. For individuals with mobility impairments or arthritis, the simple act of entering the shower can be formidable. Introducing the potential for additional dermal harm and irritation exacerbates the situation, rendering the bathing process even more arduous, depleting vital energy, and amplifying the physical strain. Surprisingly, research indicates that hot water can expedite skin deterioration, dissolving lipids, the fatty compounds integral to your skin's protective barrier. In alkaline soaps disrupts your skin's natural pH balance, which typically ranges from 4.5 to 5.5. This renders your skin increasingly vulnerable, fostering an environment conducive to harmful bacteria, fungi, and allergens. Moreover, excessive bathing not only damages your skin but also impairs your body's ability to combat infections. When the skin's barrier is compromised, it becomes significantly more susceptible to detrimental bacteria, potentially resulting in infections such as cellulitis or, in severe instances, sepsis. What commenced as a commendable hygiene practice may inadvertently compromise the body's capacity to heal, resist infections, and recuperate from wounds. Consequently, experts now advocate for a modification in the bathing frequency for seniors. Rather than daily showers, decreasing the frequency of baths could enhance one's defenses against infections. This is supported by research, including studies published in esteemed journals such as the New England Journal of Medicine. Research indicates that seniors who bathe less frequently experience fewer skin tears. Although skin tears may appear trivial, they can be detrimental for seniors, as they require prolonged healing and facilitate the entry of bacteria and other harmful pathogens. For individuals accustomed to the notion that daily bathing is vital for hygiene and health, this revelation may be difficult to accept. However, consider the possibility that infrequent bathing could enhance skin health, diminish the risk of infection, and potentially improve overall quality of life. We are poised to reveal insights that could fundamentally alter your perspective on personal care as you age, particularly regarding the concealed risks of skin tears and the significant impact of bathing practices. While one might regard a scrape or skin tear as trivial, it is essential to recognize that for seniors, even the slightest injury can have grave repercussions. Unlike the robust skin of youth, which readily recovers from cuts and bruises, aging skin is fragile, thin, and considerably slower to heal. As we age, our skin experiences significant changes. Blood circulation diminishes, the immune response weakens, and cellular regeneration declines, all indicative of aging. When the skin sustains tears, the healing process is markedly slower than in youth, occurring at a glacial pace, which increases susceptibility to infections. These exposed wounds can serve as entry points for pathogenic bacteria, such as Staphylococcus aureus or Streptococcus, potentially resulting in cellulitis, abscesses, or even life-threatening systemic infections like sepsis. This underscores the importance of proper bathing habits. Frequent washing, particularly with hot water, compromises the skin's natural defenses by depleting the lipid barrier. This barrier, a microscopic shield composed of fats and oils, maintains the cohesion of skin cells, retains moisture, and prevents the ingress of harmful substances. Hot water and abrasive soaps dismantle this protective layer, rendering the skin vulnerable. Additionally, scrubbing the skin to achieve a sense of cleanliness introduces mechanical stress that exacerbates the degradation of the skin structure. Consider this: the act of donning a sweater, brushing against a coarse surface, or merely frequent contact with your skin can result in minute fissures in this delicate tissue. Over time, these microabrasions accumulate, forming a landscape of tears and cracks, each serving as a potential entry point for harmful pathogens. However, this situation is not inevitable. Research, including findings from the New England Journal of Medicine, indicates that seniors who bathe less frequently, approximately every other day or 2 to 3 times weekly, allow their skin to retain its natural oils and restore its defenses. Targeted cleaning with a damp cloth for specific areas is advisable. Areas such as the armpits, groin, and face can facilitate hygiene maintenance without exposing the entire body to the detrimental effects of daily showers. The advantages of decreasing bathing frequency extend well beyond mere infection prevention. Fewer skin abrasions result in diminished pain, reduced medical consultations, and a lower likelihood of complications that could lead to expensive hospitalizations. This is especially pertinent for seniors with restricted mobility or resources. Minimizing doctor visits for dermatological concerns enhances overall quality of life. The unseen dangers of daily showers. Why fall should be your primary concern. Statistics from the Centers for Disease Control and Prevention, CDC, reveal a troubling reality for older adults. Over 1 in 4 individuals aged 65 and older experiences a fall annually. These incidents are not mere statistics. They signify genuine health crises, resulting in millions of emergency room visits, numerous fractures, and, regrettably, a substantial number of fatalities. For seniors over 70, the risks intensify with advancing age and muscle deterioration. Muscle strength wanes, reflexes decelerate, and conditions such as arthritis, neuropathy, and osteoporosis can undermine balance and stability. Furthermore, the prevalent issue of diminished flexibility elucidates that what may appear to be a mundane shower could indeed pose risks that are not readily apparent. Consider the surfaces encountered in the bathroom: slippery tiles, soap suds, or the slick enamel of a tub. These commonplace elements can transform a simple task into a perilous endeavor, particularly for seniors who are already vulnerable. Experiencing mobility challenges, each shower necessitates a sequence of meticulous maneuvers, such as stepping over a tub ledge and balancing on one leg to enter. Exiting while drenched, with steam obscuring vision, disorienting heat, and fatigue from prolonged standing, exacerbates the peril of this situation. A mere misstep could precipitate a fall, which is no trivial concern. Such an incident may lead to a fractured hip, a traumatic brain injury, or a cascade of health complications that can significantly impair well-being. Your independence is paramount. In contrast, consider a less frequent bathing regimen, such as bathing once or twice weekly, supplemented by targeted cleaning of critical areas like the face, underarms, and groin. This adjustment substantially decreases the frequency of potentially hazardous bathroom visits, thereby reducing your exposure to the risks associated with the bathroom environment by over 50%, significantly diminishing the likelihood of a fall. The essential trade-off is that immaculate cleanliness is considerably less vital than ensuring physical safety. Minor dirt, perspiration, or even a slight odor poses significantly less risk to health than a fractured femur or a concussion. For seniors living alone or with limited support, the danger of falling may determine whether they can maintain independence in their homes or must transition to assisted care. This issue transcends mere comfort. It is fundamentally about safety. Practical modifications, such as installing grab bars, utilizing non-slip mats, or converting to a seated shower, can effectively mitigate risks. However, ultimately, minimizing the frequency of bathing tackles the fundamental concern. Fewer bathroom visits lead to diminished fall risks. The evidence is unequivocal. Research indicates that fall prevention strategies aimed at mitigating unnecessary hazards yield significant reductions in injury rates among the elderly. Emphasizing safety over an arbitrary hygiene standard is not merely prudent. It constitutes a life-saving reassessment of what is genuinely vital in later life. The skin's extraordinary self-cleaning mechanism suggests that reduced bathing may be pivotal for enhanced well-being. Remarkably, your body possesses an extraordinary self-cleaning mechanism that operates without the necessity of water or soap. This phenomenon is not a mere trendy concept. It is a biological process refined over millions of years of evolution. Your skin, rather than being a passive barrier, functions as a dynamic living ecosystem, teeming with beneficial bacteria, natural oils, and a delicate equilibrium of pH and moisture. Collectively, these components collaborate to maintain your skin's health, resilience, and unexpected cleanliness, particularly for seniors whose skin is already susceptible to the effects of aging. Excessive bathing can compromise this fragile system. Each time you cleanse your skin with hot water or abrasive soap, you eliminate the natural elements that safeguard it. You are eradicating beneficial bacteria that maintain skin resilience and stripping away oils that retain moisture and offer protection. Let us examine how this self-cleaning system functions. At its core lies the skin's microbiome, a vibrant community of microorganisms, including bacteria, fungi, and microscopic mites. Microbes naturally inhabit the surface of your skin. While many individuals perceive these organisms as undesirable, they are, in fact, your skin's most valuable allies. For instance, Cutibacterium acnes and Staphylococcus epidermidis are two species that flourish on dead skin cells, sweat, and excess oils. They decompose these substances into innocuous byproducts while safeguarding against harmful pathogens. Additionally, these beneficial bacteria generate antimicrobial compounds that function as miniature chemical defenses, repelling invaders such as Staphylococcus aureus, a prevalent pathogen. The perpetrator of skin infections, sebum, the oily secretion from sebaceous glands, forms a protective layer on the skin that aids in moisture retention and dirt repulsion. The natural process of desquamation, which involves the shedding of dead skin cells, facilitates the cleansing of the skin's surface without the necessity for abrasive scrubbing or chemical cleansers. This entire mechanism establishes a balance or dynamic equilibrium that maintains skin health and cleanliness. However, frequent bathing, particularly with hot water, disrupts this intricate system. Water dissolves sebum, rendering the skin dehydrated and susceptible. Harsh soaps, characterized by elevated pH levels, eradicate beneficial bacteria within the microbiome, thereby disrupting this fragile equilibrium and facilitating irritation, inflammation, and infection. For seniors, whose skin naturally produces diminished oil and exhibits reduced microbial diversity, such aggressive cleansing can be detrimental. Research published in dermatology journals, including the Journal of Investigative Dermatology, indicates that excessive washing results in increased occurrences of dryness, eczema exacerbations, and allergic reactions indicate a systemic imbalance. Conversely, reducing bathing frequency to 2 or 3 times weekly enables the skin to retain its natural oils and microbiome. Utilizing mild, pH-balanced cleansers when necessary can facilitate cleanliness while safeguarding the skin's natural defenses. This straightforward adjustment could significantly enhance skin health by diminishing dryness, irritation, and inflammation, thereby promoting its inherent vitality. The capacity to safeguard personal hygiene and mitigate odor effectively represents a healthier strategy for seniors. A primary concern regarding hygiene, particularly with advancing age, is the management of body odor. However, this issue does not necessitate daily full-body showers for effective resolution. For seniors, the essence of sustaining freshness resides in the focused cleansing of areas prone to perspiration, such as the underarms, groin, and feet. This approach enables the maintenance of cleanliness and odor neutrality in high-sweat regions while permitting the remainder of the body to operate naturally. The natural rhythm for older adults is not only pragmatic, but also emancipatory. It alleviates the physical burden and fatigue associated with daily bathing while safeguarding the skin's integrity. Crucially, it enables the body to function as intended, sustaining its natural equilibrium and resilience. By minimizing excessive washing, one bolsters the body's intrinsic defenses, including the skin's microbiome, oils, and moisture-regulating mechanisms, all of which collaborate to maintain cleanliness and health. Humans have prospered for centuries with limited bathing, utilizing nature's resources for hygiene long before the establishment of daily showers as a cultural norm in the 20th century. Throughout ancient times and much of history, bathing was infrequent, and individuals preserved their health with significantly less daily cleansing. Contemporary seniors can draw inspiration from this historical resilience, trusting that their bodies can uphold a fundamental level of cleanliness without the necessity for incessant scrubbing. This historical perspective underscores the notion that infrequent bathing is both natural and advantageous leads to healthier skin that is less irritated, more balanced, and better able to defend itself. Ironically, by reducing the frequency of washing, one advances their overall well-being by granting the skin the necessary time to repair and sustain itself, thereby promoting long-term skin health. If you are still engaged, I trust you find these insights valuable. If so, please comment number 2 below. Please inform us of your presence. And if you have not yet subscribed, I urge you to do so and activate the bell notification to ensure you do not miss any of our forthcoming videos. Your support enables us to persist in producing valuable content that empowers and informs you. Now, let us proceed with a transformative recommendation that may fundamentally alter your understanding of personal hygiene for seniors. Leading experts in geriatrics and dermatology now advocate that seniors bathe only once or twice a week. This is not an invitation to neglect hygiene. Maintaining cleanliness or allowing standards to decline represents an evidence-based transition aimed at addressing the distinct requirements of aging skin and bodies. Rather than disregarding personal care, this methodology signifies a significant departure from the antiquated daily bathing principle. It embodies an increasing awareness of the detrimental effects of excessive washing, particularly for individuals over 70. This shift is gaining momentum within the medical community as research consistently uncovers the adverse impact of frequent bathing on aging skin, with experts from esteemed organizations such as the Academy of Dermatology and Johns Hopkins University emphasize that frequent bathing is not universally essential. Aging skin becomes thinner, drier, and less oily, rendering it particularly susceptible to damage from harsh water and soaps. This guidance extends beyond mere surface care. It involves harmonizing hygiene practices with a senior's overall health and condition. As we age, our skin's capacity to retain moisture and combat environmental stressors declines. Excessive bathing may jeopardize this balance. The frequency of bathing should be customized to individual requirements, taking into account factors such as activity level, health conditions, and personal comfort, rather than adhering to a strict regimen of daily showers. Experts advocate for a reevaluation of the necessity for daily showers, emphasizing the importance of personalizing hygiene practices to suit one's unique circumstances. For instance, a sedentary retiree may not require the same bathing frequency as someone with a more active lifestyle. Individuals who predominantly remain indoors do not produce as much perspiration or dirt as active seniors who partake in gardening or daily walks. This distinction is significant. What is suitable for one individual may not be requisite for another. For seniors experiencing issues such as incontinence or chronic wounds, specialized cleaning may be required, yet a daily full-body soak is frequently unwarranted. By moving away from the antiquated notion that daily baths are imperative for all, we can adopt a more individualized approach to hygiene, rooted in the genuine requirements of the body rather than in 20th century marketing promoting soap advertisements or standards of freshness. Consider that studies indicate excessive bathing may be detrimental, particularly for seniors. Frequent bathing can result in skin deterioration, irritation, and, in certain instances, pressure ulcers in frail adults. It compromises the skin's natural defenses, rendering it more susceptible to infection. By decreasing the frequency of baths, seniors can maintain their skin's protective barrier. Practicality is essential in this context as well. Engaging in bathing once or twice weekly, supplemented by targeted cleaning of areas such as the face, hands, or groin, can effectively uphold hygiene without the burden of a complete body wash. Experts indicate that odor, which frequently prompts the inclination for daily showers, can be managed with minimal effort. A swift wipe with a damp cloth, a change of attire, or the application of deodorant may be adequate. This transition is not about compromising standards, but rather about astutely adjusting to the body's inherent requirements. It demonstrates that, at times, less is indeed more, particularly when informed by scientific principles. Common sense dictates that the physical toll of daily showers extends beyond mere inconvenience for numerous seniors. Bathing, a task that appears straightforward, can transform into a taxing ordeal that depletes their energy reserves and strains their aging bodies. This reality is frequently neglected, yet it is essential for comprehending the significance of reducing bathing frequency. Indeed, research from the Journal of the American Medical Association, JAMA, has highlighted how active washing can provoke debilitating symptoms. As individuals age, the routine of bathing, whether stepping into a shower or exiting a tub, transforms into a formidable challenge due to diminished muscle strength, increased joint stiffness, and reduced stamina. This seemingly simple activity can evolve into a strenuous endeavor, resulting in significant fatigue. The physical demands of bathing are intricate. Standing for merely 10 to 15 minutes under warm water can impose stress on the cardiovascular system, particularly for seniors with pre-existing heart conditions or compromised health. The circulation of heated water dilates blood vessels, potentially reducing blood pressure and inducing dizziness or lightheadedness, creating a risk of fainting in a slippery bathroom, a considerable hazard, far more perilous than mere body odor. This illustrates the concealed dangers of bathing, particularly for seniors facing challenges such as chronic obstructive pulmonary disease, COPD, or compromised lung function. For these individuals, the simple act of breathing during a shower can become arduous, as the steam intended for relaxation may instead exacerbate their difficulties. Exhausting and distressing, this daily struggle compels individuals to gasp and struggle for breath, serving as a significant source of physical stress that depletes energy and exacerbates pre-existing health issues. Consider those afflicted with arthritis. Nearly 50% of adults over the age of 65 are affected, as reported by the CDC. For these individuals, every movement, be it twisting, bending, or reaching, induces pain. Tasks such as washing their feet, stretching to cleanse their back, or gripping a slippery bar of soap aggravate already inflamed joints, transforming simple activities into painful endeavors. The ordeal that was once a mundane activity now transforms into a challenging experience fraught with discomfort. Additionally, seniors with neuropathy face the difficulty of entering and exiting the tub. This condition diminishes sensation in the feet, making the previously effortless balance and strength arduous to restore. The physical toll persists even after the shower. Toweling off, drying inaccessible areas, and dressing subsequently deplete the remaining energy, leaving many seniors so fatigued that they feel compelled to lie down. Exhaustion persists long after inhibiting individuals from partaking in their preferred activities, such as walking, cooking, or socializing with loved ones. The Journal of the American Medical Association, JAMA, has emphasized that this cycle of energy depletion can result in chronic fatigue, particularly for those already experiencing frailty. This ongoing challenge with daily hygiene can undermine a senior's autonomy, hindering their full engagement in life. However, envision the impact if bathing were to become less burdensome. Rather than adhering to a daily bathing routine, seniors might consider bathing only once or twice weekly, potentially utilizing a shower chair or handheld nozzle to alleviate physical strain. This modification would not only conserve energy, but also allow for engagement in more meaningful activities, such as playing with grandchildren, pursuing hobbies, or savoring tranquil days without the exhaustive demands of lengthy showers. Research indicates that a reduction in bathing frequency correlates with decreased fatigue and enhanced mood among seniors, thereby promoting energy conservation. Not only does it promote physical health, but it also augments mental well-being, cultivating a more dynamic and optimistic perspective on life. A transformative approach to hygiene entails understanding that reducing shower frequency is not an admission of laziness or disregard. Rather, it is a deliberate decision to restore vitality. By acknowledging that bathing does not necessitate a daily struggle, seniors can liberate themselves from the draining routine of excessive washing and redirect their energy towards the pursuits they cherish. However, here is the most significant paradigm shift to adopt is that hygiene does not equate to a full-body bath. This notion may seem revolutionary, particularly for those raised with the belief that cleanliness necessitates a daily soak. However, contemporary alternatives offer equivalent care without the hazards associated with frequent bathing. Practices such as using wet wipes, hand washing, oral hygiene, wearing fresh clothing, and regular grooming can effectively uphold hygiene while ensuring seniors remain comfortable and confident. These customized self-care routines circumvent the associated risks of traditional bathing. Regular bathing is essential to maintain seniors' freshness, health, and dignity. It is not a matter of economizing, but rather of adopting a more intelligent approach to self-care as we age. This involves redefining hygiene and customizing personal care to accommodate the realities of aging. The strategy for personal hygiene in later life should not focus on diminishing standards, but on recalibrating them to correspond with the challenges of aging. Effective hygiene prioritizes strategic, individualized choices over mere water usage or shower frequency that accommodate the evolving requirements of seniors. There exist numerous practical and highly effective alternatives to the conventional full-body bath. These alternatives are not mere shortcuts. They are formidable solutions for hygiene, each specifically designed to address the needs of aging skin and mobility challenges. Consider wet wipes. These pre-moistened, gentle wipes provide a swift and soothing method for cleansing critical areas such as the underarms, groin, or face, regions where perspiration and bacteria commonly accumulate. They are sufficiently soft for delicate skin, necessitate no rinsing, and effectively eliminate the It is essential for seniors to maintain stability in a slippery shower, as this enhances hygiene by making it simpler, safer, and more comfortable. Hand washing, a fundamental aspect of infection prevention, effectively addresses dirt and germs that commonly reside on fingertips, which frequently contact doorknobs, food, or faces. While hand washing does not necessitate a complete body scrub, it is remarkably effective in curtailing the transmission of germs. Additionally, oral care, often neglected in discussions about bathing, plays a significant role in overall cleanliness and health, with brushing being a critical component. Flossing and utilizing mouthwash combat bacteria responsible for halitosis, dental caries, and periodontal disease, while simultaneously preserving oral freshness and aesthetic appeal. Regularly donning clean, lightweight, and breathable garments aids in moisture absorption and odor elimination. These minor modifications can significantly enhance personal hygiene and comfort. Hair maintenance, such as a swift combing or wiping, can sustain a refined appearance without necessitating a complete wash, particularly beneficial for seniors with constrained energy or mobility. The task is frequently considerably simpler than standing beneath a showerhead. The application of deodorant or a spritz of body mist constitutes a straightforward yet effective personal care regimen that enables seniors to maintain a sense of cleanliness, freshness, and dignity without the physical strain associated with a daily bath. This method is transformative for seniors encountering physical or environmental obstacles. Envision an 80-year-old with unsteady hands or a compromised knee grappling with a showerhead or ascending into a bathtub. Such actions can be intimidating and hazardous. However, utilizing a cloth for wiping down or changing into fresh attire is a viable alternative. The use of dry shampoo or a warm washcloth is a practical solution for seniors in colder climates, where wet hair and cold bathrooms pose a risk of pneumonia. This approach is safer and more comfortable than a full bath. Research in geriatric nursing supports this transition towards alternative bathing methods, indicating that seniors who adopt these practices feel equally clean and socially acceptable as those who bathe daily, without experiencing the skin issues, fatigue, or exhaustion often associated with daily showers. This strategy prioritizes dignity, particularly for individuals dependent on caregivers, by empowering them to manage personal hygiene according to their own preferences rather than conforming to a rigid, universal bathing schedule. Ultimately, hygiene should be tailored to the individual rather than dictated by cultural norms or marketing messages. As one ages, the focus shifts from excessive scrubbing or frequent bathing to intelligent, adaptable choices that honor the body's requirements, transforming hygiene into a low-risk art form. Comfort, safety, and health are paramount. A novel perspective on aging advocates for minimalism. As we age, our bodies undergo transformations that may elude our comprehension, and cherished routines, such as daily bathing, can become counterproductive. Excessive washing depletes the natural oils that safeguard our skin, resulting in dryness, itchiness, and susceptibility. This practice diminishes our vitality, rendering even basic activities like showering physically taxing. The hazards associated with a slippery bathroom may surpass the inconvenience of minor uncleanliness. The demands placed upon us can create a sense of instability. However, the remarkable irony lies in the fact that our bodies possess an inherent ability to self-cleanse. The natural interplay of beneficial bacteria, moisture retention, and cellular turnover collaborates to maintain cleanliness and health. In reality, reducing bathing frequency to once or twice weekly, tailored to individual needs, can promote healthier skin, diminish fall risks, and restore valuable energy for activities that genuinely enrich our lives, such as walking, socializing, or simply savoring the day. This is not a universal approach. It involves rethinking hygiene to suit individual needs. Whether through the use of wet wipes, hand washing, or changing into clean clothing, these customized routines can maintain your dignity, health, and independence. It is not a matter of forsaking cleanliness, but rather adapting your habits to respect your body's requirements as you age. Envision liberating yourself from antiquated routines and adopting a more manageable, secure, and dynamic method of aging. This strategy is supported by expert insights and practical experience. The evidence presents a subtle transformation in self-care, reduced water usage, diminished risk, and enhanced vitality. This is the commitment of bathing less, a reality deserving of acceptance. What implications does this hold for you? What insights have you gleaned from this video that could alter your personal care regimen? Perhaps it involves replacing your daily shower with a swift wipe, prioritizing hand hygiene, or reevaluating the concept of cleanliness as you age. Reflect on how these revelations may benefit you or someone you cherish. This has prompted a shift in your perspective. Please share your reflections in the comments below. I am eager to learn how this has impacted you and whether you found the video beneficial. Kindly remember to like it, share it with someone who may gain from it, and subscribe to our channel for additional insights on aging gracefully. Your support enables us to provide content that empowers you to live more intelligently and healthily. Thank you for being part of this journey. I anticipate seeing you in the next video.